Hey everybody, welcome to the first episode of Smoky Mountain Echo, Haywood County, North Carolina's new podcast. I'm Dylan Huffman. Today we're going to talk about Medicaid expansion in North Carolina and what that means more specifically for folks here in Haywood County. I've got Teresa Allison here with me from Haywood County Health and Human Services. Teresa, how you doing this morning?
Hi, I'm doing well. How are you doing today?
I'm good. Let's kind of jump right in with Medicaid expansion. What exactly does that mean for people in North Carolina?
Okay, so what that means, by definition, the rules for eligibility for Medicaid has expanded, and that started December 1st. And what that means for people in Haywood County and North Carolina more broadly is that more people may now qualify for Medicaid benefits that would not have qualified prior to December, and that includes people that have higher incomes.
What specific health care services under Medicaid do people have access to?
Medicaid covers most health care services. It includes things like doctor visits, and that includes preventive and wellness services, hospital services, maternity care, vision and hearing services, prescription drugs, behavioral health needs, dental care, and medical-related devices and other therapies.
So who's eligible now that may not have been eligible before?
Someone who lives in North Carolina is between the ages of 19 to 64, who is a U.S. citizen or a qualified non-citizen. And of course, there is an income test. And when I say income test, to illustrate that point, for example, a single adult who has an income less than $1,676 per month, and annualized, that's $20,120, may now qualify for Medicaid. A family of four could have an income up to $3,450 per month. That's an annual amount of $41,400. And those figures that I just gave you are before tax numbers.
So I imagine that's a lot of people here in Haywood County.
There will be a lot of people that will qualify for the benefit that might not have before. And in fact, as of last week, Haywood County had 1,838 residents who are now enrolled in Medicaid that qualify under the expansion program.
Do you think there'll be more?
I do think there will be more, and I think that will be ongoing as more and more people apply. I think we'll see our enrollment numbers continue to increase.
So what does that mean for you and your office over at Haywood Health and Human Services?
So in December, when Medicaid expansion was implemented, we saw a tremendous response in the number of applications. We got probably about triple the average number of applications that we would have seen prior to December. And in January, those numbers have stabilized somewhat, but they still continue to be more than we had seen before. And I think that will be a trend that we'll see for months to come. And I think what that means for us, too, any applicant who is approved for Medicaid, of course, has to be reviewed at least annually and make sure that they still qualify for the program. So not only do the initial application volumes look larger, but our workloads will increase as well as we have to continue reviewing those beneficiaries for qualification.
So I know you said that there are about 1,800 folks who have already signed up here in Haywood County. Do you have an estimate of how many people are eligible here in Haywood County?
Based on projections that I had seen, it could be up to 3,000, and that was a ballpark estimate based on our county population and income information provided by the state.
So based on that, do you think that the state is going to have a problem ensuring that there's enough healthcare providers to meet all these needs?
I think that's always a consideration when you have a program that is implemented with the kind of response that we have seen.
Yeah.
I would imagine that many of the private health plans that manage the care for Medicaid beneficiaries, at least many of them, and also in partnership with the state. I imagine they've been working very closely with medical providers to ensure that they have capacity. And also, I would think that they've probably been recruiting and encouraging providers that may not accept Medicaid patients today to consider doing that.
So do you think Medicaid expansion is going to make it easier or maybe more difficult for providers?
I think it'll make it easier for them. If you look at it from an economic perspective, I think Medicaid expansion will help the state and the providers specifically to receive income for healthcare services that they may have not gotten before, because more people that were maybe previously uninsured will now have Medicaid to help cover their cost of care. And then that way, the providers can reinvest their money back into patient care. And then from the other side of looking at the patient's health care, if more people have Medicaid and they're more proactive in going to their doctor and getting their health care needs met, I think that can help them as well have better healthy outcomes because of those preventive services that they'll be receiving.
So what are some of the potential long-term benefits of Medicaid expansion here in North Carolina and more specifically here in Haywood County?
If North Carolina sees similar outcomes to what other states that expanded Medicaid before us have reported, I think there's a potential economic benefit to providers, again, by reducing the number of uninsured patients. I think that could also lead to job opportunities if providers expand and offer and create jobs to help cover the provider services.
Yeah.
And then also there's the health perspective, and I hope to see a healthier Haywood because more people will improve their health outcomes and be more proactive in addressing their health care needs.
So are there any challenges that you see with all of this?
To answer that question from the Economic Services Division and Health and Human Services, I think the one thing that I would see as an ongoing challenge for us is to make sure that our resources, both staffing and technology, keep up with the trends and the enrollment and the increased workload that I think will continue to be a long-term objective for us with Medicaid expansion.
So what are some of the ways that folks can sign up for Medicaid?
There is just about no wrong door to approach services. People who would like to apply online can do so through a portal called ePass. They can apply in services at our agency, Health and Human Services. They can complete an application, mail it in, fax it in, email it. They can also drop it off in a drop box that we have in the front of our building 24/7. And they can also apply by telephone.
So let's talk about two events that we have coming up, which are kind of exciting here in Haywood County for Medicaid enrollment. We're going to be on site helping folks sign up, giving out free information. Tell us a little bit about those.
Okay. I'm very pleased to be able to partner with Haywood Regional Medical Center and Mountain Projects, and we collectively are going to get together at two different locations. Tonight we'll be at the Waynesville Public Library between the hours of 5 to 8, and we'll be available. We'll have staff that will be available on site to help take applications, answer questions about Medicaid, and help people guide through that process. We'll be having a second event then Thursday night with the same hours between 5 and 8 at the Canton Library. And the reason that we intentionally selected two evening events was, first of all, to help increase accessibility to the application process and our staff and learn more about Medicaid. And for those working families that may not be able to come to the agency or call or whatever during business hours, will have an opportunity to do that. And I also would say that for anybody that might be interested but has transportation issues, they are welcome to call Haywood Public Transit and discuss with them the opportunity for some transportation assistance. And their number is 828-565-0362.
We want to make it as easy as possible for folks in the community.
We want everybody to have the opportunity that wants to do so.
Absolutely. Teresa, thank you.
Thank you for inviting me today.
And like Teresa was saying, those two events tonight for Medicaid Expansion. The first one is tonight, Tuesday, January 31st, 2024, from 5 to 8 p.m. at the Waynesville Library. The second one is this Thursday coming up, February 1st, 2024, from 5 to 8 p.m. at the Canton Library. Haywood County Health and Human Services is located at 157 Paragon Parkway in Clyde, and their main phone number is 828-452-6620. This is Smoky Mountain Echo, the Haywood County, North Carolina government podcast. Whether you're a longtime resident, a newcomer, or just curious about the workings of local government, our podcast is your go-to source for staying connected and informed. New episodes drop the last Tuesday of every month, and they're always available on demand wherever you find your podcasts. You can check out our website, smokymountainecho.podbean.com. That's smokymountainecho.podbean.com. We'll see you next month.